So I once floated to a unit where the charge nurse was new, like just graduated, barely out of orientation type of new. It was a rural town. We were short staffed. It was one of those places where you're part pharmacy, part respiratory therapist, definitely lab, and somehow you're still expected to keep everybody alive. And of course, most of the staff was travel, and we had no idea that she was new. So when things started to go sideways, a patient crashing in sits, and admit rolling into three, a full coat brown in the hallway, the ER scanner going off, I kept waiting on her to call the shots, to give orders, to delegate, to lead. She didn't. She froze. She was trying, but it was a full moon kind of night, total chaos, and the pressure, it was swallowing her. But she was the charge, and so everyone expected her to handle it. And you know what? Everyone was frustrated. Not because she was a bad nurse, but because when you're in that role with that title, you're expected to lead and adapt, even when it's too much for one person. The organization expects that, the doctor expects that, and the staff definitely expects it because you're the charge. They're looking to you for answers. And that's exactly what's happening in medical practices right now. Practice managers are being told to improve quality, but in reality, you're asking them to shift the business model, to navigate a full-scale system change toward value-based care without proper training, without support, and without strategy. You're expecting them to lead the shift, but no one taught them how to drive this type of transformation. They were trained to keep the ship running effectively and operating smoothly, not to rebuild it or reposition it. And when the penalties hit, when performance drops, when physicians start panicking, everyone turns and looks at the manager like, well, what are you gonna do? What happened when our scores dropped? Why did that happen? Explain it. What are you gonna do to fix it? But let's be honest. Did anyone show them how to connect performance gaps to actual data? Did anyone teach them how to lead through value-based care strategies with a 100% patient-centered approach? No. CMS basically is telling them to just go pick an MVP and go. Let's talk about that, because these MVPs, they are not what you think. Originally, when MIPS launched in 2017, 2012, I can't remember exactly right now, the pitch was simple. Let's offer transparency. Let's let patients see the quality of care they're getting. So it started out voluntarily. Then it became the standard. And these penalties don't just hit your MIPS score, because MIPS, HEDIS, and UDS all share information, and their goals are very similar. Basically, they want to increase quality and lower costs, or you're going to get penalized, or affect your ability to participate in commercial and managed care. And that is your lifeline if you plan on accepting insurance. So as they've been rolling out these programs every year, making changes every year, and still expecting you to understand it fully and succeed, everyone has been struggling. So CMS introduced MVPs, MIPS value pathways. Sounds like a solution, right? But I need you to step back and look deeper and think about what the real goal is. MVPs are supposed to simplify your efforts and make it easier to concentrate your efforts. But if you really dive deep into them, they're asking you to do what most of us have been refusing to do. Pick more high priority measures, which ironically have higher penalty weights because they directly impact the patient. They're easing you in just like they did before. And while they're saying this will make it simpler, the reality is requirements are multiplying. There are like 195 now. Margins are shrinking, and cost and quality now make up 60% of your score. And if you're a small practice, it makes up even more. And unfortunately, most clinics don't have the infrastructure for timely follow up for things like the depression screening that needs to happen in 7 days post discharge, or the ability to capture data proactively to know what they're doing before their performance report. Just because a measure is required doesn't mean it's realistic for your clinic right now. Value-based care, pay for performance, is loaded with expectations around care coordination, follow-up, chronic disease management, and social needs screening. Your workflows have to be mapped. Your team must be trained, and you need ongoing access to the right data. In order for this to work, you have to have the systems to back it. And here they are, still rolling on as practices crumble. But can we really fault them? If you just think about it for a second, this is the same entity that put the entire full Social Security number of the vulnerable elderly and the vital military members and their family for years, and never thought maybe this is not a good idea until 2018. So let me ask you, do you really think they're trying to help you keep more of your money? Because at the beginning, the message was do well and we'll reward you. But that's over. This isn't about incentives anymore. It's about expectations. And they've already shown us what happens when those expectations are not met. The Primary Care First program cut. The statement they released, we are not abandoning primary care. But if you have to say that, you probably kind of are. No one is coming to save us. This isn't a staffing problem. It's a systems problem. And right now, we're throwing practice managers into the fire, expecting them to lead practices through an evolving, unstable, underfunded system without training, tools, or time. And ultimately, it's the physician who suffers in the end by losing their practice. Then what happens to the patients that they care for? And then we wonder why private practices are failing, why burnout is high, why revenue's disappearing. This shift isn't just hard, it's dangerous. Because if we don't rethink leadership, training, and strategy, we're not just putting patients and practice managers at risk, we're gambling the survivability of private practice altogether.